The first step in pain management after surgery is actually prevention. When you come into the ambulatory surgery center prior to surgery, you'll get a few doses of things like Tylenol, anti-inflammatories, and other medications to help reduce your pain off the bat. I also use a lot of local anesthesia so that you don't have pain right after surgery. When you go home, I advise that you use things like anti-inflammatories or Tylenol unless, recommended against by your primary care doctor. Those are really good ways to reduce all baseline inflammation and pain. I will give you a small prescription for some strong pain medications that can be used just for breakthrough pain. Also, ice. Please use ice at your discretion. Things you can do to reduce swelling are, number one, keep the bandage that I put on until I tell you to take it off. You'll wake up in recovery with a bandage on the penis and scrotum, and that should be kept on for the first 24 to 36 hours. That's really, the goal of that is to reduce swelling. I also may leave a small surgical drain. That reduces the amount of excess fluid in the area and reduces inflammation, helping you heal faster. Other ways to reduce swelling are using ice and anti-inflammatories in the first few days after surgery. With regard to the incision, there's nothing that you need to do. There will be surgical glue over dissolvable stitches. Those you should just leave alone. You don't need to put any ointments or creams on. It will just all heal on its own. After about a week, you may notice some flaking of that surgical glue. Just let it fall off by itself. Then the stitches will take their time to dissolve, and you'll notice that they'll fall out after the first few weeks. But there's nothing that you need to do to the incision. I ask that you start pulling the pump down into your scrotum as soon as you feel comfortable. It's nice to do when you're in the shower, when things are warm, softened, and more comfortable. And this is just a gentle pulling of the pump down to the bottom of the scrotum. This will prevent the pump from riding up and prevent any need for revisions of the pump. You can avoid constipation by first reducing the amount of strong pain medications that you take. Relying on things like Advil and Tylenol reduces your risk of constipation because they don't cause that side effect. Things like stronger pain medications, oxycodone, things like that are what will cause constipation. If you do have to take those medications, that's okay. I just advise that you take a stool softener or something like Miralax, kind of a gentle laxative at home. That should help you with the constipation. I do want you to avoid straining to have a bowel movement. I want you to avoid heavy lifting for the first 4 weeks after surgery. That's anything greater than about 10 to 15 pounds. With regard to bathing, I'd like you to avoid bathing for 2 weeks. You can still shower and let soapy water run over the incision and the area. In fact, it may be soothing, but please avoid soaking in a tub. When it comes to driving, there are sort of 2 rules of thumb. First, you definitely shouldn't drive if you're still using strong pain medications, those narcotic pain medications. Second, it may be advisable to hold off on driving if you're still experiencing significant pain. You can return to work as soon as you feel comfortable. If you're working from home, certainly you can, work a few days after surgery. If you have to go in and do manual labor, you're going to want to probably take 2 weeks off. I would expect that you will probably be sore for the first 2 weeks after surgery. The 3 and 4 week period are when men are feeling better but may still have some tenderness just to touch. And by 4 weeks, most men are feeling back to their usual selves. It's important that you reach out to us if you're concerned about things like infection or significant swelling. Some bruising is expected, and that can extend all the way up to the low abdomen or down the thighs. If you're seeing swelling that's getting bigger and bigger over the days, or you feel significant pain that's increasing, or if you see anything coming out of the wound like fluid or blood, please let us know and we'll have you come in to be seen. By the time you schedule surgery, you will most likely have already scheduled your follow-up visits. Sometimes you have 2 visits, and some patients have 3. The third extra visit is on day 2 after surgery if I leave a surgical drain. If you don't have a drain, you don't need to come in 2 days after surgery. All men come in at about 2 weeks after surgery to have the implant deflated and just to check everything and make sure everything's healing well. And then 4 weeks to work with me to start to inflate your implant, learn how to use it, and make sure you're comfortable. That's the time when I give you the thumbs up to go ahead and use it. Most men are able to use their device for sex at about 4 weeks after surgery. If you have questions during your recovery, feel free to revisit these videos, to reach out to my surgical scheduler or our clinic nursing staff. They're very good at answering these questions.